In select hospitals in the country, a push is being made to standardize and improve services for mothers and babies. Called the Mother Safe Hospital Initiative, the program is a set of 12 agreed-upon guidelines that include areas such as a safe motherhood hospital policy, training, equipment, educational material for clients, standard antenatal care and delivery care, postpartum care for mothers, data collection, and an external and internal audit process to monitor, supervise and evaluate adherence to the MSHI standard.
For me, the Mother Safe Hospital is a place where the mothers, they feel they're safe when they come, in terms of like they come in for their deliveries. They think that they come into a safer hands, where we have trained personnel, we have equipment number to serve the moms, and we also do our documentation properly, whatever services we have provided.
Of all the 12 components of the MHSI initiative, staff education, documentation, and the ongoing external and internal audit process have resulted in measurable improvements in the services provided to mothers and babies, because progress can be tracked and gaps in health services quickly identified and addressed.
One of the training that we go along with at the moment is the MNOC. And this is one of the training, I think, with the GAF-HSSP for always sponsoring this. And at the moment, I think all those staffs who have been here for the past year, they have all gone through MNOC. Also, when we have the training, we make sure when they come back to the ward, we see that it's implemented. And only when they do this kind of training that they're able to go on when there's emergency, they come in and attend. Because what I've seen is that when new people come in and when they get their training, when there's emergency, they are not able to go.
All the care that you have done, that you had delivered to the patient, it's supposed to be documented. In case that something happens to the patient, that will safeguard us.
The MSHI initiative has been a resounding success, with measurable improvement across the selected hospitals. A highlight has been the Nandi Subdivisional Hospital, which improved from 50% in the fourth quarter of 2014 to 83% adherence in June 2015, which means a fully functioning rating for 10 out of the 12 MSHI standards.
In Nandi Hospital, we had a lot of complaints, customer complaints. What we have seen now is we might just receive 1 or 2 per month now. What we used to receive before was like about 10 to 15. We couldn't go back and see what services were provided, not because it wasn't documented. Now, when things are documented, it's easier for us. If there is a complaint, we can always refer back and see what happened. Did the nurse really do that, provide that service and it is documented, or is it just the patient is complaining about it, or where the downfall was? And as you know, for us nurses, if you don't document something, that means you haven't done it.
Since the initial external audit in 2013 and the additional 3 that have been done since, the Fiji Health Sector Support Program has used gaps that were identified to provide targeted assistance to selected hospitals to help them improve adherence.
When the help comes in, even for me, sometimes I'm frustrated, but when the help comes in, I know that there are people out there who are willing to give in for this kind of, and this is one thing that boosts the morale that's here in the world, especially after our months.
When the feedback was given to us from the audit teams, the external audit teams, it really boosted their morale. They're really into it, doing things according to the standard that is required.